Channel 3's Cam Smith is following this breaking news tonight. He joins us live in the studio. Cam, what have you learned?
Well, Darren and Kiana, 77 people lost their jobs today after 146 positions were slashed. The other 69 jobs were unfilled. This comes as network leaders say skyrocketing healthcare costs forced them to make tough decisions. Amid what the University of Vermont Health Network calls a healthcare crisis, dozens are set to lose their jobs.
This isn't a reflection of their work, but of the changes happening in healthcare that are demanding us to take this kind of action.
Leaders say the more than 100 positions cut are primarily administrative, like in finance, human resources, and project management.
The necessity is the mother of invention, that we've been pushed to do that because we don't really have another choice if we're going to continue to serve our patients.
On top of job cuts, the network is also working to find other efficiencies, like reducing travel nurses and unnecessary testing and minimizing stays in the emergency department.
And we look at certain diagnoses, and we're looking for those diagnoses of admission where maybe we're an outlier compared to national benchmarks, and trying to reduce that length of stay, find the reasons why we're challenged to get those patients out sooner.
The network also announced they'd be halting performance-based bonuses for all leaders until September. In total, the new cuts aim to save the network over $180 million.
What we're seeing today is a microcosm of what's happening throughout the country, and particularly in rural healthcare.
Tuesday's changes come as the network has already made $152 million in cuts and other commitments. However, there's still uncertainty as to whether more cuts could come in the future.
To be totally transparent, it's hard to tell right now, but we're looking at every job, quite frankly, starting from my role across every organization in our system. So I can't say no to that yet. I think there are going to be more changes coming up down the road.
The UVM Health Network says those who were laid off today will have the opportunity to apply for other positions within the network. Darren?
Thank you, Cam Smith, live in the studio.